So yes, should I start, sir? Yes, okay. So good evening and welcome everybody to Global Yoga Festival. I welcome you all to this Global Yoga Festival, which is a year-long festival. Many celebrations many activities for everyone, such as yoga and wellness sessions, panel sessions, quizzes, live guiding sessions by speakers, kirtan, bhajan, and chanting. My name is Vaidehi Barge. I am a level 1 student at Swasti Yoga Center and a physiotherapist by profession. So this Global Yoga Festival is started to commemorate 75 years of independence. And this is about giving information about health and yoga and making global yoga acceptable for everyone, reaching. So during the fight of independence, techniques like satyagraha and ahimsa were used. So these are parts of yoga. Everyone can take something or the other from this Global Yoga Festival. And let us start today's session with Omkar Mantra and Patanjali prayer. So let us close our eyes. Take deep breaths. Calm the breathing. Inhale and exhale. We will do 3 rounds of Omkar. Let us join our hands in prayer. Yogena chittasya padena vacha malam sharirasya cha vaidakena lopa karottam pravaram munina patanjalim pranjaliranatosmi. Rub your hands together. Place them on your eyes. Feel the warmth. And slowly open your eyes. Namaste. Welcome. So today we will be having, as a guest speaker, we will be having Dr. Shrikant Wagh. And the topic for today will be the efficacy of yoga in arthritis. So he is an MD in medicine, consultant rheumatologist, and he has done his rheumatology training at GS Medical College, Mumbai. He has a special training in systemic lupus, soft tissue rheumatism, spondyloarthritis, and osteoporosis. So he has his private medical practice since 1982 and rheumatology practice since 2006. So he's a principal investigator in national and international drug trials on osteoarthritis, rheumatoid arthritis, ankylosing spondylitis, and systemic lupus. So publications in national and international journals and books. So his significant contribution to public awareness and education about arthritis in a form of 5 Marathi books, 3 translated in Hindi and English, over 40 articles in lay press, radio and television interviews, and even in YouTube channels. So he has special interests in yoga. He has a diploma in yoga, Sanskrit. He has an MA in Sanskrit and Hindustan classical music. He also has an MA in that. as well. So he owns a clinic, lupus clinic at Tirak Road in Pune. So welcome, Dr. Shrikant Wagh, sir. Please give a round of applause for sir. So could you start sharing the screen and as well as on the camera?
Yeah, sir, there's a small green colored share screen option. So you can just click on that and you can share your presentation.
Small green colored?
Yeah, in the center, lower bottom, you will find share screen. Yeah. So there, if you press, you will find your presentation and you can, yes, absolutely.
Are you able to see my screen now?
Yes, yes, yes. Yeah.
Fine, thank you.
Make it slideshow. Perfect.
Okay.
We can start.
Is that all right? Are you able to see everything?
Yes, sir. We can see you and we can hear you well, loud and clear. Welcome, sir. A big round of applause. Thank you, sir, for being a part of the Global Yoga Festival. Thank you very much.
Yeah, namaste. We shall be discussing the efficacy of yoga in arthritis today. I'm Dr. Shrikant Wagh. I'm a rheumatologist. I practice, although I have done a master's in Ayurveda, I practice entirely allopathic rheumatology, but my roots are in Ayurveda and also in Sanskrit, and so I learn. I have an attraction for yoga. I practice yoga every day, so I think I have some little authority on speaking about yoga, and especially its uses in arthritis. As discussed with Dr. Vikas the other day, I understand that this lecture will be for yoga teachers and those interested in yoga. So let's first see as to what is arthritis. The arthritis affects about 14.1% of the population, and this prevalence of arthritis is much higher than the various well-known diseases like diabetes, hypertension, then the coronary vascular disease and cancers. Out of these patients, something like 9% patients they suffer from spinal pain, and some 8% people they suffer from knee pain. Osteoarthritis is from osteoarthritis is the incidence of osteoarthritis is 6.4%, and the incidence of spondylosis is about 3.2%. There is something called as inflammatory arthritis, which can be either in the spine or in the joints of the limbs, which is about 1.1%. And there are other forms of arthritis, which the incidence of them is about 4.9%. Arthritis is a huge burden on the society, on our resources, because arthritis gives rise to difficulties in activities of daily living, difficulties at workplace, like lost jobs, or maybe some patients will take up a part-time job instead of a full-time job. 54% of the people have prolonged disability. Everything means, all these things means that there is a lot of financial loss, there is psychological pressure, and there is diminished quality of life. So the overall burden on the society is higher than the heart diseases, the diabetes, ischemic heart disease, then cancer and asthma. It is important to understand the difference between years of life lost versus years of life lived with disability. So the disability is extremely important in the arthritis patients. So is the importance of arthritis. Before going to arthritis, let's just have a look at a synovial joint. We have some 200 bones in our body, and there are 200 joints. So out of these, the synovial joints are those where some movement occurs, and these joints will have this is a bone, another bone, the surface of which is covered by articular cartilage, and then there is a sac, which is called a joint capsule, within which is the synovial membrane, and then we have joint cavity in which there is synovial fluid. All the movements at the joints occur because of muscles surrounding them. The joints don't move. Don't move themselves. The movement occurs because of muscles. So there are muscles and tendons that are responsible for the movement at the joints, and the fixity of the joint is because of these ligaments. So this anatomical description is important for understanding as how there are different types of arthritis and how they differ. We have at least 100 types of arthritis. Arthritis is not a single disease. This is osteoarthritis. Osteoarthritis is also also known as degenerative. Although there is some recent evidence that some amount of inflammation is there in osteoarthritis also. So osteoarthritic knee, the first thing that occurs is eroding of first thing that occurs is erosion of the cartilage, then erosion of the meniscus, then exposure of the bone, and then formation of bone spurs. The osteoarthritis, there are various etiological factors like age. This is supposed to be a disease of aging. Then it usually occurs in female sex. Usually occurs in females. There are some occupational causes also. Osteoarthritis can occur following an injury or following surgical interventions of the joints. Then we have inflammatory arthritis. 1 minute, I forgot that this osteoarthritis is a long-standing disease, and it usually develops very slowly, so that that is a big difference between osteoarthritis and inflammatory arthritis. Inflammatory arthritis usually comes acutely, and the prototype of inflammatory arthritis is rheumatoid arthritis. Also, we have certain diseases like spondyloarthritis, in which there is inflammation of the spine. Then we have viral arthritis. Septic arthritis is due to infection. Then we have various systemic diseases like systemic lupus, vasculitis, and so on. And then sarcoidosis, also sarcoid is another disease. Then cancers can also lead to inflammatory arthritis. And there is one condition which is known as generalized osteoarthritis, which can also have an inflammatory stage. So the main feature of arthritis is pain. And that pain is the one, it is the one for which a patient will seek advice of the doctor. So there is difference between inflammatory arthritis and non-inflammatory arthritis. The most important difference is the morning stiffness. Actually, in inflammatory arthritis, the morning stiffness will be there. The joints will be stiff after a period of rest, and this stiffness will last for half an hour, at least for half an hour in the morning. Then for inflammatory arthritis, there will be intermittent flares, and there will be improvement in pain and stiffness after use of the joints or after exercise, or the pain worsens at night, and there will be constitutional features like anorexia, then maybe feeling feverish, and so on. In Ayurveda, we call these as the features of ama. The ama features are the constitutional features of these inflammatory arthritis. And then there are only two blood tests, that is erythrocyte sedimentation rate, and the second one is the CRP, that is C-reactive protein. So all of these are positive in inflammatory arthritis and are not seen in osteoarthritis or other forms of non-inflammatory arthritis. Then we have other rheumatic conditions like frozen shoulder, in which the shoulder movement is less and is usually painful. Then you might have heard about tennis elbow, various types of tendonitis, bursitis, and then strains and sprains. These are soft tissue rheumatism or extra-articular. These are not inside the joint. And then sometimes we have generalized pain. Fibromyalgia is the most important of them. And we have chronic fatigue syndrome, then various types of metabolic bone disease. The hand which is the hand which is seen here is in a patient of diabetes. Diabetes. The fingers are stiff, so that the exact fulfilling namaskar is not possible. That is endocrine disease, and there are various other causes which I am not going into the details. I suppose that you are all aware of this Ayuranga Yoga, which includes Yama Niyama, Asana and Pranayama. Actually, these are the sutras from Patanjali Yoga Sutra. Ahimsa Satya Asteya Brahmacharya and Brahmacharya and Aparigraha. These are yamas. Shaucha Santosha Tapa Swadhyaya Ishvara Pranayana. All of these are yamas. Then about asana and pranayama. These are the definitions given in the Patanjali Yoga Sutra. The effects of the various yoga sessions are essentially dependent upon its effects in the brain. Now this flowchart shows the effects of stress on the brain, with activation of the hypothalamic pituitary axis and the sympathetic nervous system. Actually, we are discussing yoga the other way around. That we are discussing the stress element first and yoga later on. We must understand how stress works on our brain. So it works through the hypothalamic pituitary adrenal axis, which is also known as HPA in short, HPA axis, and the sympathetic nervous system, SNS. The hypothalamic, the HPA axis activation of HPA axis will increase the levels of glucagon. It is given here. Will increase the levels of glucagon, and which will ultimately lead to increase in the blood sugar. I'm not going into too detail, but the essential are these. Then second one is the renin angiotensin system, which will increase the blood pressure. And the most important thing is the increase in the level of cortisol, which will increase the level of lipids, that is cholesterol and others, which will increase the level of sugar, which will increase the levels of sugar, and which will also increase the inflammatory cytokines. Here, inflammatory cytokines are important in inflammatory arthritis. These cytokines are extremely important. And then we have various effects on the behavior in the form of anxiety and depression. The sympathetic nervous system is another thing which is excited, which will lead to increase in the epinephrine secretion, which will increase the heart rate, and the stroke volume of the heart, that is cardiac output, is increased, which will finally lead to blood pressure. So all these effects of stress, these are all effects of stress, and these will ultimately lead to especially the inflammatory types of arthritis and various effects of those inflammatory arthritis, as well as various effects that can be associated with the inflammatory arthritis. Okay, now we go to the effects of yoga per se on this HPA system, on this sympathetic system, and so on. So it has been shown that yoga increases the endorphin secretion. So endorphins are normal elements in the body, which are called as which are endogenous opioids. Opioid is a drug which can also be given externally, and that opioid is these opioids are used as analgesics. So the endorphin secretion will lead to modulation of pain, and as well as inhibition of pain perception. As we have already seen that for every arthritis, the main symptom is pain, and the effect of yoga is endorphin secretion, which will lead to which will certainly lead to suppression of pain because of these endorphin secretions. Then we have the second one is increase in the level, increases yoga. Yoga has been shown to increase the levels of neurotransmitters such as GABA, acetylcholine, and serotonin. There are other transmitters also, but I don't want to complicate the issue. And actually, this particular GABA is important in depression and anxiety diseases. So that depression and anxiety both are usually associated with arthritis. You can understand that depression can easily come with arthritis, pain, and the various effects of arthritis per se. Then the yoga effects on autonomic nervous system. The sympathetic nervous system is suppressed, and the parasympathetic system is excited, that leads to increase increase in the vagal tone. So the effects of these are decreased heart rate, and then the blood pressure control, and a significant improvement in the functions of lung. And then we have inflammatory cytokines. We have already seen in the earlier slide. These inflammatory cytokines are interleukin 6, then the human necrosis factor alpha, and the high sensitivity say, CRP. These are decreased due to yoga, which means that there is improvement in the immune function, and there is decrease of the pro-inflammatory responses. So this particular function is important in all autoimmune diseases like rheumatoid arthritis, systemic lupus, even the ischemic heart disease, and ischemic heart disease, as well as diabetes is nowadays considered as autoimmune. So you can understand as to how this how these effects will ultimately lead to an improvement in the arthritis condition. The HPA axis, I think we have already discussed this. You can see that for every slide there is a reference given. The down regulation leads to reduction of the cortisol levels. Then stimulation of brain, it increases the cerebral yoga increases the cerebral blood flow and reduction in stress. So the it has effects on insulin resistance, hypertension, and ischemic heart disease. Okay, now we'll shortly discuss the various rheumatic conditions in which yoga has been shown to be effective. Now, this is the first paper published in 2019, effects of yoga on patients with chronic non-specific neck pain. Actually, this is a systematic review and meta-analysis, which is a very high-grade evidence in which they studied 10 patients, in which they studied 10 different studies with 686 patients, and they concluded that practice of yoga relieves the intensity of the neck pain, improves the pain related functional disability. Then it increases ROM, that is that is the range of motion. It improves the quality of life, and it boosts mood. Now the second study is the impact of yoga on LVP and function. This is another systematic review and meta-analysis. They selected 7 studies with 185 patients, and it is observed. It is observed the pain was less and visibility was also less, and statistically significant improvements. Statistically significant improvements in pain and function persisted for up to 6 months, even after stopping the regular yoga practice. And then there is one other study, another systematic review on osteoarthritis of the knee. Here they included 6 studies. Number of patients was 732 with 40 to 90 minute session for 8 weeks. The effect of yoga on pain relief and function improvement seen after just after 2 weeks. Although the effect on the quality of life are unclear. Various musculoskeletal effects are there. It increases the strength of muscle, the endurance and flexibility of muscles. The stretching also improves the metabolism of bones, and strong muscles and bones mean the less chances of injuries related to falls. We have another study. It's not study. It is it is a good review, which concludes that studies in yoga have reported moderate improvements for gait, balance, and upper and lower body flexibility, and an increase in the body strength, along with a decrease in the body weight. This is important. Body weight effect on body weight is also important as far as osteoarthritis is concerned. And then there are various psychological effects like anxiety. For anxiety, they say that yoga is effective and safe. This is another meta-analysis which includes 8 RCTs. RCT is randomized controlled trials with the number of patients 319. For depression, it is useful as seen in this meta-analysis of 19 studies consisting of 1,080 patients. Yoga improves the sleep quality with shorter sleep latency and reduced sleep disturbances. And it improves the mood and cognitive function too. So these psychological effects are also useful as far as arthritis is concerned. We have various rheumatic conditions like osteoarthritis, rheumatoid arthritis, systemic lupus, and fibromyalgia, in which there is reduction in pain and improvement in function and stiffness. It also relieves stress, anxiety, and depression. Ischemic vascular disease, vascular events such as myocardial infarction and stroke are less, and associated hypertension, then diabetes, hyperlipidemia, and obesity are also controlled. So, in various arthritic situations, yoga appears to be extremely useful. This yoga, actually, they studied of arthritis and osteoarthritis, randomized control trial with after the depression also improved, the flexibility improved, and the grip strength also improved. Then this is about fibromyalgia. They studied some 53 females with 8-week yoga, and this also improved the symptoms and functioning. Fibromyalgia is a different disease where there is pain everywhere, and it is fleeting type, intermittent. These usually in female patients, and they usually have anxiety, depression associated. The pain decreased, fatigue decreased. There were good improvement in mood, and there was better coping with yoga in fibromyalgia. I think that's all. My time is over. Thank you so much. You can get more information in these books. I have around 15-16 books to my credit. And this particular website, Arthritis-India, which is the largest website on arthritis and associate and related diseases from India, which can also give you some extremely good information on arthritis and other related diseases. Thank you so much. I would like to mention this Swasti Yoga Center and Dr. Vikas for inviting me. I'm thankful to them. Thank you.
Thank you, sir, for this wonderful session. Being a physiotherapist, this session was like a gold card session for me. Since I've seen patients with osteoarthritis, I see patients like on a daily basis. So I will definitely read your books on those, and I'll try to pass it on to the patients. So thank you so much, sir. I would ask Vikas sir to felicitate Dr. Shrikant Vag, sir.
Absolutely. I would request everyone to unmute themselves and give a big round of applause to sir. We are absolutely very much privileged to have a legendary person who has dedicated decades into the research and development of arthritis, the field of rheumatology in India, and taken our sciences at a global level. So thank you very much, sir, for the wonderful presentation, the in-depth work that you have presented here. And this will be a great motivation for many students, because many of our students are from various fraternities, healthcare fraternities like Ayurveda, homeopathy, or it could be physiotherapy and other sciences. And many of our teachers are also practicing yoga therapy. So for them, this kind of differentiation between osteoarthritis, rheumatitis, inflammatory, non-inflammatory, and all these kind of basics, which are very, very important whenever we are prescribing yoga practices, and especially asanas and mudra bandhas. So this knowledge is going to be really very helpful. I would definitely, from Swasti Yoga Center, a small piece of respect to you and your contribution. Thank you very much, sir. And if anybody has any questions or would like to express themselves, please unmute and share your thoughts.
Namaste, Dr. Wagh.
Namaste.
Okay, first of all, for a layman in the medical field like me, there were lots of technical jargons. So first thing I will need to do is I will need to buy a dictionary, again, to translate these terms. But nevertheless, I got one assurance that if you're on the path of yoga, you can overcome, this, what you call diseases, or that is one. I have one question for you.
Yeah.
For a layman, like I would say, I would consider myself a layman when you present it. But if you, from your experience, if you have to put three things in order, in what you call the way we live our lives, daily lives, and I would probably put myself first, right? My lifestyle is, I'm in front of computer 99% of the day, put it that way. Okay. And, I probably get up, I would say probably once every hour for a few minutes. So if you have to, suggest three things, for me not to have these things, what would you say?
Not to have arthritis.
Yes. No,
Actually, exercise per se has got some preventive role in arthritis. Although there is difference between exercise and yoga, but I have a feeling that people who do regular yoga practice, they have these people are likely to get less arthritis than the normal population. And regular yoga practice would usually mean that whatever studies are published so far is just 60 minutes, 60 minutes and 3 times a week. So I think that should be increased to 60 minutes or maybe 45 minutes for 5 to 6 days a week, and that will certainly lead to prevention of arthritis for an individual.
Good. Thank you so much.
Yes. So for our yoga fraternity, if you want to decode this very complex research, 3 keywords again which are coming from Yoga Sutras. One is abhyas. That is what all the researchers are pointing out. Sir is also saying regularity is abhyas. We wake up one day in the morning and for the next 10 days we are not there. So that is not. Abhyas is what all the researchers are pointing. The second is Shraddha. We have to believe in what we are doing. So that's will help you to enjoy these practices. And the last important thing is Vairagya Bhav. With this kind of detachment, you would be able to absorb yourself into it. So great. Thank you very much, sir. Thank you very much.
And I would like to add one thing, that this particular lecture was specially prepared because I was informed that the lectures would be heard by the audience. Audience would be the teachers of yoga. So that's why I thought that scientific discussion will be more important and will be more valuable for them.
Yes. It is very motivating for all the teachers. Definitely, sir. Yeah. Vaidyaji?
Yes, sir. So thank you so much So the next sessions would be on the topics Daily Yoga for Corporate Professionals by Sonam Lodam. And so next slide, please. And Ahimsa and Satya, Pillars of Yoga and Indian Freedom Movement from Srinivas Pulluri. So next Saturday, Sunday. Thank you for joining in, and please do join in again. And let us end this session with Shanti Mantra. Please close your eyes and fold your hands in prayer position. Take 3 deep breaths. Om Sahana Vavatu Sahana Bhunaktu Sahaviryam Karvavahai Tejasvinavatitumastum Vidvishavahai. Om Shanti Shanti Shanti. Rub your hands together. Feel the warmth. Place them on your eyes and open your eyes. Thank you so much. Namaskar.
Thank you. Thank you, everyone. Thank you, sir.